Welcome back to From Both Sides of the Couch. This is Dr. Lori Bruce. Hopefully you have been following my series on the hidden gifts of emotions. I have been sharing the ways in which we benefit from even our most painful emotions. As a clinical psychologist, I work with patients every day who are hurting and feeling painful emotions. And when we are in a tremendous amount of pain, we really don't want to understand the benefits of the pain. We truly just want to make the pain go away as quickly as possible. And that really makes perfect sense. However, when we are able to step back from our current pain and take a larger perspective, when we can ask ourselves, what can I learn from this? Is there any possible way in which this situation or feeling is helping me to grow? When we can ask those questions openly and honestly, we have so much that we can learn. And that's what we'll be talking about today. Stay tuned. Welcome. My name is Dr. Lori Bruce. I'm a clinical psychologist and mindfulness coach, and this is From Both Sides of the Couch. In this podcast, I will be sharing with you ideas, strategies, and nuggets of wisdom from my 25 years of experience as a therapist and as a client in my own therapy. I am passionate about helping the helpers, those of us who are caregivers, either by profession or in our personal lives. Join me as we explore topics such as building resilience, self-care and self-acceptance, reducing stress, anxiety, and guilt, and how to live the happiest and most fulfilling life possible. Let's get started. In two prior episodes, I covered the hidden gifts of the emotions fear and anger. Today, we're going to talk about the emotion of sadness. Let's start by getting to know sadness. What exactly is sadness? Sadness is the emotion we feel when we have lost something important to us. We feel sad when things turn out differently or worse than we expected them to. We feel sad when we lose someone to death or divorce, or even just when someone close to us moves away. Sadness is all about loss. The loss of a relationship, a pet, an object, or even an idea about how something should be. We all know sadness. In fact, all emotions are universal. There's not one person in the world who has not experienced sadness. What does sadness feel like in your body? For me, I feel sadness as a pressure or a heaviness in my chest, like a weight that is pressing down on me. I also feel it in my throat, like my throat feels kind of tight. And total honesty, in this past year, I have felt more sadness than I have ever felt in my entire life. And I can physically feel it in my body. For me, experiencing such a level of sadness is exhausting. I find myself feeling more tired and depleted after the normal activities of my day. And on some level, it feels as if my body is just carrying an extra weight around, like this huge sack of potatoes just lugging this weight around with me everywhere I go. And it's hard to carry this extra weight around with you. It's much easier to just lay in bed or sit on the couch and watch Netflix all day. You really have to push yourself to move when you are deeply sad. When you're very sad, you might also find that you cry a lot, or you might even find that you can't cry even if you want to. I've had moments in the last year where I feel like I'm just completely out of tears. My tear well has just run dry. And when we're sad, we feel very unmotivated. It's the opposite of the energized feeling that you might have with anger. With sadness, you just feel depleted and unmotivated to do anything. We just want to lay in bed. We might lose our appetite with severe sadness, but with more mild levels of sadness, we often eat more in order to find just a little bit of comfort or a little bit of joy. It's so hard to find joy, and when sadness is prolonged, we may find it difficult to feel joy or interest in anything. One of the questions I get a lot as a therapist is how to tell the difference between regular sadness and depression and grief. Although we often use all of these terms interchangeably, they're actually just a little bit different. Depression, in a clinical sense, is a period of at least 2 weeks in which we have a variety of symptoms in addition to the sad mood. We might have problems with our sleep, we might have fatigue, we might have changes in our appetite or weight, a decrease in our libido, we might have difficulties focusing or concentrating. With clinical depression, we might feel even worthless or have excessive feelings of guilt. And with severe depression, we might even feel hopeless or have suicidal thoughts, or maybe just passive wishes for life to end. When we have enough of these symptoms for a long period of time, then we are diagnosed with major depressive disorder. But this is different from just the normal experience of sadness. When we feel normal sadness, we typically don't have many of those other symptoms, or if we do, we don't have them consistently for a long period of time. Grief also feels like sadness and depression. However, depression can sometimes come on without a specific reason, whereas grief is the emotions that we experience as a direct result of the loss of someone or something important to us. One of the biggest challenges for myself and my clients is when you have a history of clinical depression and then you experience grief. Sometimes our grief can actually turn into a depressive episode, and sometimes it's hard to differentiate the two because so many of the symptoms overlap. However, with normal, healthy grief, we expect in time for the feelings to lessen. We typically have an awareness that our feelings are valid and normal and will pass. Versus with clinical depression, we often feel so stuck inside of our experience that we doubt the experience will pass. On the contrary, when we are significantly depressed, we believe that we're going to feel this way forever and there's no way out. It is especially difficult for people who have a history of depression to manage their normal experiences of sadness or grief. When you have experienced true clinical depression, but are in remission, it is so painful to remember what that depression was like. And so when you start to feel a normal sadness or grief, you might become anxious that you're going to experience a depressive episode again. Severe clinical depression is just awful. If you have not experienced true clinical depression, then it's very difficult to fully understand it. I am very open with my clients about my own experiences with depression in the past, because I think it is helpful for them to know that I really, truly do understand because I've been there myself. People without a history of clinical depression often say really dumb and unhelpful things like, well, just get over it. Or my least favorite, just choose to be happy, which is really, truly just such bullshit. As if anyone with clinical depression is just choosing to feel this misery It's absurd to think that in reality we could just snap our fingers and not feel this way, but for some reason we're just choosing not to do that. That one really gets on my nerves. When we become anxious that we're going to get depressed, it can lead to a series of thoughts that actually contributes to it happening, sort of a self-fulfilling prophecy in a way. We have thoughts like, oh, here we go again, and I remember how long it took for me to get out of the last episode. What if this time is even worse? The mind and the body remember how painful the depression is, that it leads to a cascade of thoughts and behaviors that sort of inadvertently bring it on. When you don't have any history of clinical depression, you generally don't feel anxious that normal sadness would stay around forever. You recognize that sadness just comes and goes. But when you have a history of depression that can stay for weeks or months at a time, it's understandable to sort of freak out a little bit at a normal negative emotion of sadness. Part of what I do in my therapy for people who are sad and have a history of clinical depression is to remind them that sadness is a normal, healthy part of life that is not to be avoided. Give yourself space to feel that sadness without projecting into the future a depressive episode. Allow it to come and to recognize and reassure yourself that it will pass in time. In time, even people with a history of depression can learn to get more comfortable with sadness. Self-care is crucial for making sure that your normal sadness does not turn into a depressive episode. And self-care can look like a lot of things. It can just be being gentle with yourself, being compassionate to yourself, validating your feelings, giving yourself as much space as you need to feel your feelings, and trying to stop yourself from projecting imaginary scenarios into the future. Even though sadness is so painful to experience, like all emotions, there is a gift in it if we look closely enough. So what can sadness teach us? First of all, sadness shows us what is important to us. If we lose someone or something and we don't really care, then it seems obvious that the person or thing was not very important to us. We've all heard that expression about not knowing what we had until it's gone, and this is speaking to this very issue. If we feel sad when something is gone, then obviously this was valuable and important to us, even if we didn't necessarily recognize it at the time. Now that we know that this person or thing was important to us, we can either make an effort to try to get back that person or thing, or we can learn how to change our behaviors in the future. If, for example, a friend moves away and you feel exceptionally sad about that, maybe it could show you that you aren't spending enough time with the friends that you currently have. Maybe it will remind you to pause and appreciate the friends that you do have even more than you already have been. Maybe you've been taking your friends for granted or not letting them know how much they mean to you. Maybe it will teach you that you have to put in more effort to make plans or trips with your friends. Or maybe it will show you that you don't have enough friends in your life and you need to put effort into building up your social network. Maybe it will tell you that you have all your friend eggs in one basket and that you need to broaden your support system so that you won't feel this pain as intensely again. All of this and more can be learned by your sadness. Sadness can also teach us things about ourselves that we might not have learned otherwise. I have a lot of patients that come to me because they feel sad or even depressed, but they really have no idea why. If you have lived your life under a certain set of beliefs, such as, when I achieve these professional and financial and social goals, then I will be happy. And you go on and you live your life and you achieve these goals, but you find you still aren't happy. That can be very confusing. So you just keep chasing all of these achievements because you believe that the achievements will make you happy. But you continue to realize, I'm still sad. I don't know what to do. So maybe you go to therapy and you start talking about your life and what really matters to you. Many people then discover that the joy that comes from external achievements is very short-lasting. It isn't sustainable before you're on to the next goal. What is more likely to bring sustainable joy is when you know that your life has meaning and purpose. When you know that you're making a difference in someone else's life, that brings joy. So many of us don't have this sense of meaning and purpose, and we don't even know it. Our sadness can actually teach us this if we look closely enough. By finding activities such as volunteering at an animal shelter, or tutoring young kids, or working for an organization like Habitat for Humanity, or joining a local political organization, there are millions of ways, big and small, that we can make a difference in the world. It doesn't have to be huge. It can be as simple as baking cookies for a friend or signing up for a meal train at church. Knowing that you're helping someone or the community even just a little bit can make all the difference in the world. Now it's your turn. What might sadness be trying to teach you? Have you experienced a loss recently that is leading you to feel sad or even grief? If you were able to step back just a tiny bit from that emotion and ask yourself the question, what can I learn from this? What might you find? Are you pausing enough to experience gratitude for the things and people that you do have? Are you sharing that gratitude with them? Please remember not to use the concept of gratitude as a way to invalidate yourself. You can be both sad at a loss and grateful for what you still have at the same time. One does not negate the other. Do you feel you have enough meaning and purpose in your life? Do you feel you make a difference? And if not, what are some very tiny steps you might be able to take today to help someone? Are you practicing self-care? Are you validating yourself? Are you being gentle and compassionate with yourself? Or are you projecting scary stories into the future about how long your sadness is going to last? Take some time to journal about these things. Share your thoughts with a friend or talk to your therapist. And if you know anyone in your life who's going through a difficult time and feeling a lot of sadness, please consider sharing this episode with them. That would be one small thing you could do to help others. As always, I hope you have a great week ahead, and I will see you in the next episode.